Would you be a proponent of trying to work across the aisle to make some of those fixes as opposed to saying we got to start over?
Absolutely. The Congress of the United States, whether you're a Republican and Democrat in the House or in the Senate, shouldn't we all be working together on the problems that are part and parcel of who we are as Americans? This is not for Republicans to fix or Democrats to fix. This is for us as Americans to fix.
Amen.
There you go. Joining us from Capitol Hill, member of the Senate Judiciary Committee, Democratic Whip Dick Durbin of Illinois, and here on set, CNBC's Brian Sullivan. Good to have you both with us. Senator, what's it going to take to get some collaboration on this issue?
The best starting place is to use the process of the Senate. The Republicans are in the majority. Why doesn't Lamar Alexander schedule a hearing for the first day we're back after the July 4th recess? Let's put the Republican plan on the table. Let's subject it to scrutiny, to criticism, to amendment. Let's have a real national debate about an issue of national significance. Then let's bring it to the floor of the Senate. The Republicans are in the majority. Why are they afraid to do that? That's the way to bring about a bipartisan approach to this whole conversation.
Well, so let's not have an either-or approach. How do we actually get Democrats and Republicans talking together, Republicans saying, hey, listen, this program is not sustainable at its current growth rate over the next 20 years. Medicare and Medicaid, we've got a problem. Democrats can say, we understand that, but we're not going to leave millions of poor and middle-class Americans behind. Is there middle ground there? Can you guys figure out how to sit down and come up with a health care bill that's not going to be thrown out when the next administration comes in?
Joe, the key to it is the starting point. You know that. If the starting point is to have a tax break for the wealthiest people in America, then you're going to take more money out of the health care system. It means fewer people are going to have protection of health insurance or help in paying their premiums for their health insurance policies. So if you take tax cuts off the table.
Yeah, could you cite it really quickly? Because you brought up tax cuts. I'm sorry to interrupt. But I wanted to ask you to weigh in on something we've been saying this morning. It's become patently obvious that the Republicans haven't really focused sufficiently on writing a health care bill, because this health care bill only seems to be a precursor to a huge tax cut bill later on.
Someone has said, and it might have been on your show, when it comes to specialty work, the Republicans are really specialists on tax cuts. When it comes to health care, turn to the Democrats. So the question is whether we can create a political marriage here that says we can't take $1 trillion out of the healthcare system over the next 10 years, primarily for tax cuts, and expect to have more people with health insurance coverage. That's what the Congressional Budget Office told us. So I think the starting point, if it's going to be bipartisan, has to be with an agreement on starting principles.
Senator Durbin, it's Brian Sullivan of CNBC. With all due respect, sir, I mean, this fight we're having is a little bit odd because healthcare costs have been growing for 50 years. Prescription drug costs in America are up 12,000% since 1960. Per capita spending was $150 in 1960. It's $9,000 now. You've been in office since 1997. We're having this fight now, but healthcare has been a crisis for 50 years. When do you guys sit down and address cost? Why does healthcare cost so much in America, and why do Americans consume so much healthcare rather than us just fighting constantly about how to pay for a bill we should probably never have?
You put your finger on one of the major drivers in terms of increased cost in healthcare, the cost of pharmaceuticals. The Affordable Care Act does not deal with constraining or reducing the cost of pharmaceuticals, and it should. I wish it had from the very beginning. That needs to be on the table. And if you ask American families and the insurance company executives, they'll tell you this is a big driver. Now, let me also say to television networks like your own, MSNBC, this direct-to-consumer advertising by pharmaceutical companies is only allowed in 2 countries, maybe 3 now. Brazil,
you think we should end
New Zealand.
You flip into a magazine, you see some drug for gout. We should stop that. It's a huge industry.
I can tell you why. Because the consumers who don't understand the sophisticated issues about these drugs take the name of the drug into the doctor and say, will you write me this prescription? Too many of them just do. And that drives up the cost of health care for drugs that are not really effective or not really necessary. So we have to bring it all together when it comes to pharmaceuticals, and sign me up for that effort. Should Medicare be able to negotiate pharmaceutical prices? You bet it should. Let's bring down the prices for senior citizens and for the government.
Senator, this is sort of a health care question. You represent a city, Chicago, where in certain neighborhoods, parent after parent after parent is afraid to let their child outdoors because they're afraid they might get killed. What are we going to do about that health care aspect? We've been at it, again, as Brian alluded to, health care for years, for decades. Handgun violence, murders. What are we going to do?
Well, there are many aspects to this, but let me tell you one that came as a shock to me. I went to the Cook County Juvenile Facility. I sat down with these adolescents who are being charged with murder using guns. And then I sat down with the counselors who have been working with them for months, and I said, who are these kids? How did they reach this point at age 14, 15, and 16 that they're spraying bullets into homes, killing grandmothers and babies? 92% of these kids have been victims of violent trauma or have witnessed violent trauma. Think about our returning soldiers who've gone through that experience, who need a helping hand to put their lives on the right path. It's only one element, but it's a critical starting element to try to stop these gangbangers from reaching a point where killing is part of the normal routine of their lives. Summer jobs, there are so many aspects here that need to be part of it. But I hope that the federal government will help us. We need their helping hand.
Senator Durbin, it's Willie Geist. Why is the problem, in your judgment, so acute in Chicago? You've got a police force that's working hard, working overtime, as you know. But in places like New York and other major cities in the United States, there is a problem with handgun violence and death, but not nearly on the scale of Chicago. What is specific to Chicago that's causing this epidemic in that city?
A flood of guns. 40% of African American kids are unemployed, 20% of those in the Hispanic community. You have too much time on their hands, this exposure to violent trauma early in their lives. They don't have the constructive experiences that many of us had in life, a mentor in school, someone who will give them an opportunity to prove themselves with a summer job.
But Senator,
it's a package.
But why Chicago, though? Why is it so much more acute in Chicago? We have those problems across the country, but
no money.
In Chicago, the numbers are so much higher.
Well, I can't explain the volume, but I can tell you when you get to the root causes, I can put my finger on a lot of them. And we need to say to the president, when you say in your tweet, we're going to send in the feds, please do send in the federal money. We can use it.
Which president?
We can turn
President
this around.
Obama was from Chicago.
And he did a lot for the city. But I can tell you more needs to be done today. Let's be honest about it. This situation is grave. It's serious. Innocent people and kids are dying every single weekend, every single week. We've got to put the resources into it. It isn't just a matter of getting tough.
All right, Senator Dick Durbin, we appreciate it so much. Brian,
by the way,
so much
quickly,
as well.
Illinois, if Friday they don't get a budget deal, we'll go to its third year without a budget. That's why there's no money. Their credit rating may be downgraded to junk. Illinois could file for bankruptcy possibly as a state.
And that certainly makes things even tougher in Chicago. That does. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.